Hello and welcome to Mount Edgecombe Hospice in St Austell and our beautiful Cornish spring gardens that are beginning to look magnificent as the different colours come out. The setting sun has thrown the most beautiful light across the gardens and into the room that we're sitting in. We're just off the main ward, and joining me tonight are Chris Jones and Helen Treleaven, who are our lymphedema specialists. Now, we decided we'd start Lymphedema Week this year by answering the questions you might have about the condition. So about a week ago on social media, we said, have you any questions? And boy, yes, you did. So joy of joys, we're able now to address those questions for you. Though, of course, you can leave a message as we go through this live broadcast if you have any other thoughts or questions that you want to include. So I think we should make our introductions first. Chris, Helen, it's lovely to see you. Just tell me, both of you, what is it you do? Sounds like I've always had no idea. I have, but tell other people, what is it you both do?
So we both work in lymphedema clinics, cancer-related lymphedema, and there's one down in Hale and this one up at St Austell.
Yeah, that's
in
it.
In a nutshell.
That's it. We run an outpatient clinics essentially. That's our main part of the work, but we also see patients on the ward as well.
Now, that you just struck on something really important. And a lot of people are scared of hospices. They also think they're one-way streets, and they really aren't. Half our patients go home. All your patients go home after, what, an hour?
Yeah.
Yeah, absolutely. So we generally see our patients, normally our new patients come in and see us for about 2 hours, and then our other outpatients are with us anything between 2 hours and an hour.
Yeah. So here we are now proving that there are people that come in and out of the hospice and they're not staying for very long and they come backwards and forwards, and I think that's really important. And actually, as if we'd rehearsed this, we can go straight into the first question, which comes from Alison, who says, why might I have to come into a hospice for lymphedema treatment and not a hospital? Is it a terminal illness? Because if it is, no one's explained that to me.
No, it's not a terminal illness. It is a lifelong condition. It's chronic, so once you have it, you potentially always have it. And the reason you come to us as a hospice is because we both run the clinics from the hospice. There is a clinic in the hospital as well, but you just come to us if you had cancer-related lymphedema, and we see everybody from diagnosis, isn't it, Chris, all the way through to palliative patients. So we see everybody. So,
and I know you've had patients, Chris. I've talked to them in telling stories who've said, I really didn't want to come because it was a hospice.
Yeah. And I can completely understand it. It's such a good question to start on, because it is most people's main concern when they get either a letter from us or a phone call from us saying this is where you're coming. But it is just because that's how our services have evolved. It was a Cornwall Hospice Care service, and it was set up that way. And it is exactly that. It's an outpatient clinic within a hospice. You'll be coming to the outpatient clinic, and then you'll be going home again.
I'm glad you've said that, actually, because the other thing to remind people is we're a charity. And we are providing this lymphedema treatment. It is free of charge. That's the other thing. So yes, you might have to come to a hospice, but it is a free service thanks to our supporters, which is humbling in the extreme. I'm going to start back with you again, Chris. I'm sorry, because our next question comes from Alan, who says, can men develop lymphedema, and in what circumstances might that happen?
Yeah, great question. Anyone can develop lymphedema. We've all got a lymphatic system, so essentially you can develop lymphedema of any area of the body, and we know of a couple of different sorts of lymphedema. So we work with primarily cancer-related lymphedemas. So in which cases men can come on to develop will be kind of any cancer that they may develop, but also kind of male-related cancers as well. So it's anybody, unfortunately.
Is that awkward sometimes for them if they land up coming to you, Helen, a chap?
No, I think because our aim is to make people feel really comfortable as soon as they come into clinic. So before we go delving into where it is, we can kind of build up really good relationships, and we have it in such a way that quite often they're explaining to us where their lymphedema is, and quite often it's the first time that they've actually explored where their lymphedema is. And if they were to feel uncomfortable, we could send them down to Chris, but we've never actually had that, because I think we work so well together at making people feel relaxed that by the time they're coming out, they're okay actually. And yeah, so it's never been an issue yet. And we do see all sorts in clinic, you know, we can get the head and neck, we can get the male genital area as well, the legs, thighs, everywhere. So it's always been okay so far, and we're all professionals here as well. So that's really important that they remember that, and we've seen everything. You know, so for them it might be, and it is really important for them to know that we've seen most things as well, you know. So it's the first time that they've probably shown somebody it, but for us it's our norm.
And what we're hoping is obviously that during the time, either through the first assessment or subsequent appointments, that we explore the causes and also the presentations of the edema itself, and hopefully give you solutions to manage it. And if you go away with those solutions, hopefully that makes you feel better.
And it would be well worth watching the film. It's on YouTube, Simon's story, because he is looked after by you, Helen, and the relationship you have is extraordinary. It's a really comfortable one, and I think that's good for people to see.
Here initially, he was really scared to come to the hospice. So to see his relationship develop and his confidence develop coming into hospital, from a clinician's point of view, we set up what we planned to do in the first place. So yeah, it's great to see him coming and bounding through the doors now. It's really good.
So we now got a question from Isabel, who's asking about travelling if you have lymphedema. She asks, can you go on holiday if you have lymphedema? And if yes, how do you achieve that? Can someone be trained in some of the techniques in case the condition flares up when you're away? I can imagine if you have lymphedema and you have regular treatment, it must be quite scary, the thought of moving a long way away from the person who helps.
Yeah, absolutely. With everyone that we see, our aim is, yes, we are the specialists, and yes, we have all the techniques that we can use, but what we want to do is actually teach you how to manage your own condition wherever you might be. And it's more successful, it's more useful if you can develop those techniques yourself, so that it doesn't matter where you are, you can hopefully help. As far as going on holiday, absolutely. We always hate the idea of your condition of lymphedema preventing you doing anything. So what we often do is look at, okay, so what are the risks? And if, for example, if you're travelling a long way, then what we'd look at doing is making sure that you were to travel with some antiseptic cream and some skin protection. If you're going by plane and you do need to wear a compression arm sleeve, which is one of our treatment methods, and we generally recommend that you wear that a couple of hours before you fly and a couple of hours after you land and all the way during. So there are lots of techniques that we can suggest and lots of things that you can do which will still enable you to go.
And I think also I know you have, Helen, you've shown relatives how to do things
all
to
the
help.
time. Yeah, we quite often, and that's really important actually, that relatives, carers, friends can come into clinic and we will show their partners or whoever how to help do their massage. So if it's a breast, we can kind of clear the back, wherever it is really, isn't it? And that's really important, because when we're not with them 24/7. So for us, it's really important that we're not precious with our skills. We pass all of our skills on to patients, carers. So yeah, quite often we'll have patients coming in with their relatives, and we've even booked out time for relatives just to come in to be shown, actually, isn't it? So we'll actually block out that time in clinic just so that we can actually go through everything, so that the patients can go away on holiday knowing that they're okay. And that's really important, because who doesn't want to go on holiday?
Well, and also we spend a lot of time, don't we, in the hospice saying that we're here to help you live well. And there can't be anything worse than being scared to go and do something.
And you can live well with lymphedema as well. You just need to have the right techniques. And you're not just going to learn it once, so quite often we do repeat appointments just so that people can really nail what they have to do properly, so it becomes second nature to them and their partners, doesn't it? Yeah. Which is so important.
And talking about things you love to do, the next question from Sarah, she picked up on what we said when we were promoting on social media, send us your questions, and we'd raised the question, for instance, did you wonder if you could ride your horse? Because I think you'd mentioned someone had asked that before, Chris. Yes. And she emailed in and went, yeah, so can I ride my horse with lymphedema? And does lymphedema stop any sports or hobbies?
Well, that's a big question.
Yeah. Thanks, Tamsin.
Well, no, thank you, Sarah.
Yes, thank you, definitely, Sarah. It's a really good question. Again, what we what we want to try and achieve is to minimise the impact, because we know that lymphedema is a lifelong condition. We want to minimise the impact as much as possible on you, what you want to do, and on your life. And so using the horse example is a tricky one because it is very individual. So it's about how your lymphedema affects you. It's about what things you may have done before and what things you hope to do. So, for example, if you were a very keen horse rider before and you have your own horse and you know the routes that you're going to take, then the risks are they're minimised. But if it's a very new thing for you, it's going to be a bigger shock to your system and there's more risks. So it is very individual, and it is very difficult to say definitely no or definitely yes to anything. But what we always recommend is, if you're going to start something new, come and talk to us about it first. We'll go through the risks, we'll talk about what that might mean for you and your condition. We'll give you some ways to manage that risks. Sometimes there are things which are a bit dangerous. Sometimes there are things that between the two of us, between a patient and myself, we've decided, okay, maybe not that, but maybe this instead. So there are lots of ways around it.
I did actually wonder about diving.
Dive?
A lot of people dive around Cornwall, don't they? And there are implications under pressure, maybe? Or maybe I'm wrong, maybe you can dive.
I've never come across that one yet.
I'm not sure about diving,
No.
Excellent.
Yeah, no, you have. That is actually, because you can see the pros and cons for both, actually. That, yes, that pressure, because we know with swimming, any water sports like that compression will work well around your particular limb. It just depends on how deep you're going. So if you're just going like 8 meters or so, that would be fine. But if you're a deep diver, like 20, 25 meters, going to the bottom of Scylla, like it used to be in Plymouth, then I would probably err on the side of caution first.
Absolutely.
Because what you don't want to do is have a huge flare-up in your lymphedema, and then it can take weeks to get back down to normal. So that's what Chris was saying. Whatever sport you do, start off slow and steady and build up your tolerance. Because if you start a new exercise, we will find muscles that we didn't know we had. And with lymphedema, it's that aching sensation that can be part of that. Is this a new exercise? That is a new muscle? Or is it the start of my lymphedema kind of playing up a little bit? So slow and steady.
I think also, is it not about talking to the practitioner, talking to you guys, and just saying, here's my hobby. Is it a good one? What can I do?
Yeah. Lots of things that we can do to give you tips on starting new things. Lots of tips about rejoining things that you did do in the past. And again, there are going to be some things which we will decide together. Okay, maybe not that, but hopefully not many times. I mean, I can't remember too many times when I've said definitely don't do that. We've just done like a risk assessment, and again, very individual.
The next question, in a way, is quite sad, but it's quite a difficult. Well, I think it's a difficult question, but I think really worth addressing. Peter says, "My wife has been diagnosed with lymphedema, a word neither of us had heard before. Where can we find out more? But more importantly, how do we explain it to our teenage children and our elderly parents without confusing or scaring them?"
So that's a really good question. So when any of our patients come to clinic, we talk in layman's terms so that they have a real good understanding. We use body maps, and we have a really good website as well, which I'll let you explain what that one is, because I always get it wrong. And that explains exactly what lymphedema is and how it can be managed. And for us, it's exploring how much information patients want, because some want to know absolutely everything, and some just want to know, I need to just get through this next month and then go back. So it's explaining what the effects are for you, which part of the body it is, because there are some more personal parts of the body that they might not want to explain too much to family members. So I think really it's just explaining that there is a swelling, and sometimes it can be uncomfortable. It's recognising that,
and
really,
I think
actually, how much they want.
For people like Peter and his wife, look, the internet's a bit of a, it's a wild and wonderful place, and sometimes you get some great information, sometimes you get some terrible information. So if you look at, for example, Cornwall Hospice Care website, you'll be able to find our information, and then you'll be able to contact us directly if you have any specific questions, and we can talk about specific conditions better on a one-to-one basis. But there are lots of really good organisations around the country. We belong to something called the British Lymphology Society, which has got a good website, which have got some very good information on. But look at your local teams and local lymphedema clinics. And if you're in Cornwall, Peter, then give us a call and we can talk you through it.
And interestingly, Mark, who's our next caller, he said, are lymphedema treatments invasive? But he goes on to say, I've heard they're not, but I'm not sure I believe that. So it is about seeing information that's totally trustworthy, isn't it?
Yeah, absolutely. It's to answer the question, I tend to say that nothing that we do is painful. Everything that we should do should feel beneficial, so it should feel good, it should feel nice. We do a lot of massage techniques, we do a lot of work with compression, we do a lot of work with exercise, and we do talk about skincare a lot. And all these things are non-invasive and should never be painful at all. In fact, all of the things that we do make things feel better, hopefully quite quickly.
Interesting.
Yeah, I really like that question actually, because most of our patients come to us not knowing what to expect at all, because quite often they've gone to the doctors or their oncologist and they've had bloods taken, so they expect a pain element, and the moment we come in and we go, no, this is a really nice, easy get to know you, what do you want to know about lymphedema, they kind of go out going, oh, it's okay, we'll come back.
Yeah.
Because,
and mostly they do.
Yeah, most of them do, yeah. We don't have to beg them to come back. But for us, it's about the education as well, isn't it? We tell them always what we're doing and why we're doing it, and we give them the option. Quite often we'll kind of go, we really want to do this, but you might not be on board with that just yet. So we always tweak the patient or our treatment to the patients. Not one treatment will fit every patient at that particular time. So for us, it's really important getting to know our patients so that we can start tailoring what they need.
So actually going back to Peter's question, it's worth him and his wife talking to you guys or whoever is helping them about how they then talk to the rest of the family about this. You're not just there to do the treatment, are you?
No, absolutely not. A lot of what we do is information. A lot of what we do is kind of promoting our service, but also promoting what we can do about lymphedema, not just explaining who gets it and why. It is about trying to give people solutions to whatever issues they have, and if that's about asking questions and information, that's what we're here for.
Yeah, and bring the question with you. We were saying earlier, the minute you think of something, no matter where you are, write it down, and because you won't remember when you walk in the door of the treatment room. Write it down and ask it.
We do say to our patients, when you get home at initial assessment or any time, if you think of something, give us a ring, give us an email. That's what we're here for. It doesn't matter how small that question is. If they're thinking about it and it's on their mind, let us know. And then we can hopefully, if we don't know, one of us will know, won't we? So,
absolutely.
I'm just smiling because while you're talking on air, we've had a comment from Simon. I wonder if Simon is our Simon that you care for. Absolutely awesome people doing unbelievably good work, hugely undervalued, and don't hesitate to get in touch with the team.
Oh,
wow, that's an accolade, isn't it? Yeah, absolutely. The next question comes from Gillian, who said she's very embarrassed about her lymphedema, tends to hide it under baggy clothes. Are there ways I can be helped to embrace my condition so I can go back to swimming and wearing clothes that more suit my personality? I was quite sad when I read that.
Body image is huge in our clinic, isn't it? So for a lot of our caseloads, a lot of our ladies have had breast edema. So they might have had a full mastectomy, partial, or just their breast feels very different how they were beforehand. So for us, it's about getting our patients to start recognising that they've got lymphedema, looking at the different clothes that they wear, wearing a really good bra. I think we underestimate how important wearing a good bra is. And once you start getting that and they start along their journey of having lymphedema, it does become a little bit easier. A lot of our patients initially don't even want to touch their part of their body that's been affected. So we recognise that actually, and we might do a lot more intensive treatment with them just so that we can get over that big hurdle for them actually. And then once their limb or their area becomes a little bit more comfortable, they might be then more used to touching that area, especially if it is their breast area. And clothes-wise, experiment. And I think people are much more aware of it when it's their body. But when you talk to somebody, you don't really talk to their breast, you talk to their face. So I think when it's your issue, because you look down, your breast will look very different looking down than opposite somebody. Head and neck, it depends really what part of the body it is. So a lot of our patients, if it's legs, they might wear skinny jeans or floating trousers or skirts. But there's always the treatments that we can help them with, whether that be compression hosiery, the massage, the kinesio tape, the machines that we use. So explore with what makes you feel more comfortable. And we quite often, you know, we'll have patients in clinic goes, does my breast look different in this? And they want you to give them an honest answer, and we will absolutely. It's probably not about wearing stripes, because stripes you can sometimes see the unevenness. So it's just exploring it.
Yeah, I think it's a really powerful question on lots of levels, because I don't think that we have the answer sometimes. I don't think, for example, a lot of places we buy clothes from are well suited to a lot of our patients. I don't think that it's ever really been addressed as a market as a whole. And we just mentioned bras and bra fitting there. I think it's one of our ridiculously one of the biggest problems for us to try and sort out. And there isn't an answer out there. So it's almost like the industry, it hasn't really helped us at all. But what we try, again, what we would do initially, and it just depends on exactly the size and shape of the limb that we're working with and how long you might have had the lymphedema for. But certainly initially what we try and do is reduce the size of, if it's an arm or a leg, to get it down as much as possible. And then again we talk about trying to manage that and to continually keep that limb volume under control, and hopefully that helps fit into more normal clothing. It also might help you feel a little bit better about how it looks and feels.
I think you're talking a lot about there has to be a very honest and open conversation. You've got to get to know your practitioner, haven't you? Yeah. And then just be willing to ask these questions. Yeah. That I bet you've heard it all. I bet there's nothing much you haven't heard along the way.
You'd be surprised, Tamsin. I think there's always that patient that's going to make us go, oh, that's new one, isn't it? You know,
I hear new things every week, to be fair. But yes, we are. I think we've seen a lot of stuff.
Yeah, over the years.
We have a lot of great techniques that we use, and we have a lot of great treatments. Part of why I enjoy working as part of the hospice is that we do have a good capacity to respond to people's questions and to be a little bit more available. So definitely contact us.
And we quite often get the patients that just ring up and go, I'm really struggling. There's no reason why I'm struggling. Can I come in and see you? Yes, absolutely. And it'll be like, right, where are you? And they just go, I've just hit a brick wall. Yeah. Everything's been going really, really well, and I'm just struggling. Whether that's through a new diagnosis, or they just go, I've had enough. I've had enough of having lymphedema. What else can I do? And we kind of almost go back to basics, show them how far they've come along in their journey, and maybe just slightly tweak their treatments. And it's a bit like when you go on a diet, you kind of lose your way a little bit, and then you go back to it and you're back on it again. So we do quite a lot of support, even though we don't clinically need to see them. They just want to touch base with us and go, can I just pop in? Absolutely, yes. You know, and that's really important for us actually, isn't it? And that's why we don't ever have set clinical times, like we can only see for 6 sessions, or that we will see you for as long as there's a clinical need, that you can stably and mentally manage your condition on your own.
And I just wanted to pick up on something that Gillian did say about her wanting to go back to swimming. Now, swimming is actually one of the things that we try and get a lot of people doing, because it's one of those activities that you can really manage the risks and do as little as or as much as you feel that you can do. So I would, definitely try and encourage Gillian to try and get back in there swimming. And if she had a pool that she felt comfortable in, to go to that. Phone them up. Sometimes they'll have special set times which you can go, which are a bit quieter, or maybe having some times which are kind of ring fence for different conditions. So do try and get back to swimming, Gillian. It's great.
And cold swimming.
I was going to say, and actually, you know, I've got a friend who has had has lymphedema, who sea swims,
Great.
just chooses a quiet time and a quiet beach, so it doesn't matter, and I think that's
and I
really
think
valuable.
Mental stability for that as well. Just
Yeah.
going out feeling that you're doing something that makes you you is so important. And you know, who doesn't want to in Cornwall go to the beach and just float, take a waddle or whatever they're called, the noodle things, and float. You know, it's just great, isn't it? So yeah, good luck, Gillian.
Oh, lovely. Now, I did laugh when our next caller, he rang us, Bill, and said he's just been told he's got lymphedema. He doesn't want to attend too many appointments on a regular basis. He said very firmly, I farm, I'm busy.
Great.
So he said, can I help myself? We've kind of been asked this before, but how do you deal with and help someone like Bill, who actually has got an incredibly busy life and doesn't want lymphedema to ruin the timings of everything else?
Yeah, good. Yeah, well, hopefully it shouldn't. And again, what we try and do with our all of our interventions is, so our whole approach is very patient-centered. So it's all about what's important to you, what you want us to help you sort out, and what you have to do out in your life. And it has to fit in with that, because if it doesn't, it's not going to work. So for Bill, we would be definitely teaching you the techniques and hoping you can do them at home, because that's where you have to do them. So for example, if it's teaching a massage technique, we generally recommend you do massage twice a day. So that'll be once in the morning and once in the evening, but you could do it at any point during that day. If you're wearing compression, we will teach you how to wear it and how to put it on and how to take it off and how to look after it. So yeah, again, a lot of what we do, hopefully we teach you to do it and you go away and do it at home.
Excellent. And then we have Peggy, who says, and we've answered this, but let's address it for Peggy, does exercise help control lymphedema? Again, she wants to help herself as much as possible, having had a fairly recent diagnosis. So is it part of the treatment to keep moving and keep doing things?
Absolutely, yeah. And we always look at what exercise they're doing beforehand as well, because that really helps with that muscle memory as well. So you're not trying something new, you know it's safe, you know your body can manage that. So yeah, and what we say with compression, if you're doing any exercise apart from sea swimming or going in the swimming pool, then wear your compression hose, because that will enhance how your graduated compression actually works, and you get a better result from that as well. But yeah, definitely do your exercise. But if it's a new exercise, then kind of speak to your therapist just to kind of make sure that you're building up. But yeah, exercise is great.
Yeah,
really
we've always understood the importance of exercise with lymphedema. One of the key problems with your lymph system is that it doesn't have a heart to pump it around, so it relies on us moving to keep it going. And so it's important to, I mean, we talk about exercise and people often associate that with doing something like going to a gym or swimming, but it could equally be just standing up and walking around your room. So anything that will get you moving safely and gently is going to be really useful.
And just going back to what Bill was saying, the other thing is you don't have to specifically do these techniques, do you? I can remember you, Helen, saying, perhaps when we interviewed you with Simon, your patient, that some of the techniques you can do while you're waiting at the traffic lights in the car.
Absolutely.
Or while you're reading a book or something like that.
So,
that's always stuck in my mind.
Yeah. So with our head and neck patients, you know, quite often they'll be massaging their neck whilst they're stuck in traffic, whilst they're watching TV. A lot of my female patients now, if they've had any work done to the breast and that lot, I kind of go, when you're waiting for the kettle to boil or you're going for a wee, clear your lymph nodes in your arm. Little and often really, really helps, doesn't it? Because then, you know, you get up in the morning, you might be a bit running late and you forget that morning massage. You then get home from work, you've forgotten the afternoon massage, or you're tired and you forget. So that's a day that you've done nothing. So I always kind of go little and often. Your body remembers that then, doesn't it? Like your lymphatic system continuously clearing then. So it doesn't have to be set times. You can do it wherever, as long as it's, you know, not in the middle of the street maybe. Might not be the most appropriate areas to go. But yeah, like I said, our head and neck patients quite often will, whilst they're in the traffic, great.
Yeah.
You know, and it's about normalising your treatment.
Yeah.
I think because I think a lot of our patients, you know, they might see a physiotherapist, so they might be having a lot of people say, you need to do this, a diet, diabetes and that lot. So for us, it's about normalising your treatment so it becomes your everyday, so it becomes less medical, and it's another reminder then a lot for our patients that they've had cancer. So if it just becomes your everyday, it just becomes normal. It doesn't become such a big thing then.
Yeah.
And then I think that helps with that, the mental side of things as well, like the mental health.
So we will teach a full routine of massage, which is 10 to 15 minutes, and we say try and do that twice a day, maybe 3 times a day. But adding in on top of that is all these things that Helen was just saying, just about clearing your nodes throughout the day. And if it is a particular area you want to work on, then yes, you can definitely just be kind of quite secretively working on that in the bus, absolutely. Yeah.
Fascinating. It really is. And Simon has sent another message to say, pull your socks up. I think he knows you very well. I think one of the biggest learning curves, and we've referred to it several times, but it's important before we finish to just say, it's never wrong to ask a question, is it? You don't have to wait for a session like this. You can wait for, till you see a practitioner. You can go online. You can email you guys. Do you have an email address that people can email direct, or good? Oh, over to you.
Can you remember it? There you go.
Thank you. chc.lymphoedema@nhs.net, and the reason why we have the NHS email, though we're not part of the NHS, is for the security side of it, so it's a secure email.
Super. Well, before we finish, I did want to pick up on the fact that, Chris, apart from being a lymphedema practitioner, you also help to raise money, because we started by saying we're a charity. We're not the NHS, we're a charity. Yes. People who do things for us raise the money that pays for you to do the wonderful things you do for patients, like Simon. You jumped out of a plane before Christmas.
Yeah, I did.
Why? So I've been meaning to ask.
It's a very good question, actually, because I was wondering that myself at the time. Yeah, so we did a Santa skydive just before Christmas last year, which was I bet you wouldn't know what to say then. A wonderful experience. A little bit scary, but it was a great thing to do. And this year, we are cycling from St Michael's Mount in Marazion, in Cornwall, all the way to Mont Saint Michel, if that's how you say it right, which is about 300 miles. We're catching the boat across the water, I hope.
So do we.
But we're cycling the rest of the way.
So you're doing the overseas cycle. It's in October, I think.
It starts in October, right the first week of October. Yeah.
Now I can understand why you're doing it, because you want the challenge. But what drives you to work for a charity and raise money for it?
I think it's a unique place to work. I worked in lots of different places in the past, and working for Cornwall Hospice Care is a very unique experience. It's a wonderful place to be. You see the work going around you, and it just inspires you to want to raise the money, really.
Well, I can't thank you both enough, because it's actually beyond. You're on a day off, Chris, and Helen should have gone home by now, but you've stayed specially to do this, and I think it's meant a lot to the people who've asked the questions, and hopefully to the people we haven't heard from, but have learnt something tonight. And thank you to Simon. You are undervalued maybe by some people, or not understood, perhaps. Lymphedema is not necessarily understood. And, take what he says. Get in touch with you both. Don't hesitate to ask those questions. Thank you very much. Good luck with the overseas cycle.
Thank you.
Thank you for joining us this evening. We hope that you found it beneficial, just learning a bit more about lymphedema. If you want to know more, visit our website, cornwallhospicecare.co.uk, and we're going to leave you with a lovely evening glimpse of our beautiful Cornish spring garden here at Mount Edgecombe Hospice in St Austell.